Oklahoma.
Mr. President.
Senator from Oklahoma.
First of all, I thank the senator from Maine, and she used very descriptive terms, ram it and jam it. That's essentially what's happening right now. I think everyone's aware that I think all the media have taken pictures of the closed doors. They know that just a handful of Democrats were in there. Ironically, there are a lot of the Democrats who didn't know what was going on either. But they came out with a product, and it's not a good product. Now, I'm going to talk about the product in a moment, but I think it's probably more significant and more concerning to a lot of the people I talk to is the manner in which this bill be brought to the floor. It's beyond just being deceptive that the Democratic leadership plans to vote on Saturday night at 8 o'clock. To proceed to H.R. 3590, a bill that has nothing to do with health care. This bill is one that passed the House in October of this year, 416 to nothing. It would pass the Senate by a unanimous vote, I'm sure. The bill is an 8-page bill to ensure that our military service members are not excluded from first-time homebuyer tax credits, and no one had any quarrel with that. The House side would probably have any, or nor would we, but we all remember that America remembers. The House passed their health care bill, H.R. 3962, on November 7th, late at night on a Saturday night. Same type of thing that we're looking at here. Let me say one thing. I was surprised to hear the unanimous consent request that was made just a few minutes ago, because it was an admission, and I appreciate their honesty, that what we are going to be voting on tomorrow night has nothing to do with H.R. 3590, and yet that's what we're going to be moving to. They stated at 8 p.m. tomorrow night, the Senate will proceed to a roll call vote on the motion to invoke cloture, on the motion to proceed to H.R. 3590, the legislative vehicle for the Patient Protection and Affordability Care Act. My thinking was that, and I still think there are a lot of Democrats who would end up voting for this tomorrow night and then send out letters to their constituents. Oh, this is a vote that's going to help our military with some of the problems that they have. This reminds me so much, the way this is taking place, as to what happened in the Environment and Public Works Committee when they were trying to get through the massive cap and trade bill, which they did, and they voted it out without any Republicans there. It's on the floor right now. It's not going to be brought up because it's dead on arrival. People of America realize they don't want to have the largest tax increase in the history of America on something that would do no good. But the point is, the deceptive method to bring that bill up is the same thing we're dealing with now. And I think by virtue of the fact that they rammed it and jammed it, to borrow the terms from the senator from Maine, from out of the Environment Public Works Committee, caused it to go down. And I think the same thing is going to happen here. Now, the second thing is a motion to proceed at 8 p.m. on Saturday night. Well, Saturday night, what are people doing on Saturday night? They're not watching TV. They're not listening to the radio. They've got ball games. They've got other things that American people do in the American way of life on Saturday night. Now, do you think it's just coincidental? That's the same time of the night that we ended up voting they voted on the House health care bill on a Saturday night. And of course, it got out with a bare majority. Now, not only is this the way in which the bill is being brought up that would be questionable, the substance of the bill is definitely questionable. It's been repeated. I'm trying to make a couple of comments about this that have not really come to the attention as much as other issues. But the government-run health care bill, the Republicans are working to ensure that Washington bureaucracy does not get between the patients and their doctors. That's the big issue. Now, you're going to hear shortly from my junior senator from Oklahoma, Senator Coburn, who is an OBGYN. He'll talk about that. But I don't think you have to have a doctor explain to you that if you, in my case, a very large family, a lot of grandkids, we don't want the government telling us what we can and can't do. A government-run university healthcare system or a socialized healthcare system is not the answer. All you have to do is listen to some of the testimony from individuals who've come down here, like members of Parliament from Great Britain, and who came and addressed us here in this building. and said, we can't believe that something that has been such a failure that we're trying to get away from in Great Britain is something that you're now trying to move toward. And the other day in the Wall Street Journal, they talked about a Canadian citizen who waited in pain for more than a year to see a specialist for his arthritic hip. The specialist recommended a state-of-the-art procedure, but the government bureaucrats determined that the patient, who was only 57, was too old for that system. Rationing is alive and well. And if you don't believe that, you go up in the northern part of the United States, go to Mayo Clinic or some of those, and you see the large number of Canadians who've come down to barbaric America with our system because they couldn't get the type of treatment that they wanted through rationing up there in Canada. So the Democrats' bill represents an unprecedented expansion of government's control over health care. Oklahoma physicians shared with me in a July 23rd letter that they are concerned that a public plan option will unfairly compete with the private market and ultimately crowd it out. Well, it's a no-brainer. You can't compete with the federal government. All they have to do is change, and the competition is gone. So under this bill, government will tell people what type of coverage they can have, what they can't have, that every American have health care, or they'll have to pay a tax, mandate that employers provide certain levels of benefits or pay a fine, introduce a government-run plan designed to destroy the private market, include new policies designed to control what drugs and procedures Americans can receive, and require a historic expansion of Medicaid. According to the Oklahoma Health Care Authority, they're the ones who administer the Oklahoma Medicaid program. Is called Sooner Care. They estimate that this type of expansion could cost my home state an additional $128 million each year, resulting in harmful cuts in existing state priorities. And by the way, the Oklahoma governor and state legislature are now talking about going into a special session because of the problems that we have, the budget problems. And of course, then we would inherit this. The bill violates the president's promise that not to raise taxes. I think we have covered that. The fact that they have taxes like the 40% excise tax on the so-called Cadillac plans, that means if you, through your own decision, decide that for your family you want to have more extensive coverage, you're going to get penalized. You could have a tax imposed upon you of 40%. Because you wanted to have a better treatment for your family. The CBO and the Joint Committee on Taxation have testified that these taxes and fees would be almost entirely passed on to consumers. In fact, they estimate that by 2019, 89% of the taxes would be paid by those making less than $200,000 a year. It reminds me a little bit of the regressive nature of the cap and trade tax that would affect the poorer people more than the wealthier people. So anyway, with all the penalties and everything else that is in there, we're going to be looking at something that the American people don't want, they shouldn't have, and that doesn't mean that Republicans don't want to have reforms. We need reforms. We need medical malpractice reforms. I have two friends in Tulsa. It's two man and wife teams, Rick and Lisa Lowry. He is a cardiologist. She's a dermatologist. They just the other day, and they'll tell you the only reason they did it is because of the tort laws in the state of Oklahoma, moved to Tyler, Texas. Boris Bogomolov, he's a good friend of mine, his wife, Kathy, another pair of doctors. He's an electrophysiologist. She's a pain management doctor. They have moved to Fayetteville, Arkansas. Now, this is happening right now. We know what reform is. We know the HSAs have worked, giving people choice. We know that the cross state lines, many of these things that would be very easy to address, and we want to have a massive reform. I think the main thing for us to keep in mind for tomorrow at 8 o'clock is that if just one Democrat will say, no, I don't want a government-run system, just one, they wouldn't have their 60 votes. And it's going to be interesting to see if there isn't just one. And they'll never get by with saying, oh, that was a motion to proceed to a bill having to do with housing for the military. It's not going to happen. And I think the people are smarter than that. I hope that there is at least one Democrat who will oppose a government-run system. We'll find out tomorrow night. With that, I'll yield to the senator from Alaska, Senator Murkowski.